Hey everyone, it's Heart Month, so I wanted to go over some of the signs, symptoms, and things to watch out for if you have had a heart attack or if you're at risk of having a heart attack. So, some of the things to look out for starting off is if you're starting off with a new exercise program, you do want to get some doctor's approval if you feel like you're at high risk. High risk is you have two things on a checklist, and usually a gym or personal trainer provide a PAR-Q, which will have all that information on it. It's a physical activity readiness questionnaire, and two of the big signs are hypertension, even if you have medication for your blood pressure. The other one is diabetes, and another one. Next one is high cholesterol. Again, if you're on medication for the cholesterol, it just still counts as a sign or a symptom. If you have any of those, or if you have two or one or two of those, then you should really consult your doctor before you participate in a moderate to heavy exercise program. If you do have one of those two things, you can still participate in a light program, but it is recommended that you talk to a doctor. And a light program is just on a bike, pedaling at 50 to 60% of your max heart rate, or just doing a nice light walk. So, what makes you at risk for having a heart attack? Uh, One of the things that they use is family history. Now, again, family history you have to understand is father, brother, uncle, mother, daughter, aunt. So it's not everybody in your family. To show immediate risk, those are the six people that they look at. Next up is if you're a smoker. Smoking puts you at increased risk for a heart attack. Uh, if you have hypertension or on medication for hypertension, high blood pressure, then that's a risk factor for heart disease. Another one is high cholesterol or dyslipidemia. Again, just because you're on medication doesn't mean that it's not a risk factor. Uh, if you have impaired fasting glucose, diabetes, type 1 or type 2. Type 2 is more associated with heavier set individuals. And if you have a higher circumference around the waist, or waist to hips is what they call it, that ratio, then that is also a risk for heart disease. And finally, a sedentary lifestyle. The more we have our computers, the more we're on our phones, the less we're moving. So you do want to make sure that you're participating in physical activity. You want to do at least 30 minutes a day, most days of the week. You can break it up to 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, however you want to do it. But get your 30 minutes in regularly. Watch your step counters, they help. Finally, if you are getting to the point where you're worried if you are at risk for a heart attack or you're having a heart attack, there are some signs and symptoms. One is pain or discomfort in the chest. We all know that classic sign, grabbing the left arm. But the non classic signs are jaw pain, and in women, especially, upper middle back can be a real big area where they can get discomfort. Next one is dyspnea or shortness of breath with regular activities. So things that you don't normally get out of breath with. Dizziness or syncope. Syncope just means loss of consciousness. So if you're getting really dizzy and the dizziness is causing loss of consciousness, get yourself to the hospital, get checked out. Uh, Orthopnea or proximal nocturnal dyspnea, same thing as shortness of breath, but in a reclined position. So if you're sitting back and you start getting a loss of breath, but you sit up and it goes away, that's also a sign of heart problems. Ankle edema. So if you're getting swelling in your ankles from just standing and doing nothing, where you can press into your leg and your fingerprint stays there, then that's a sign to also go talk to a doctor. Usually that's associated with blood pooling in the feet, which means there's something going on with the circulation, getting that blood back up to your heart. Next is palpitations or tachycardia. So where your heart feels like it's beating out of your chest and really, really rapidly. That's another sign that you want to go and get checked out and make sure there's nothing else going on. Uh, Intermittent claudication, the fancy word for saying you're getting pain in your muscles while you're working, but as soon as you stop working, that pain goes away almost immediately. That that's also another sign that you want to go get checked out. If you have a known heart murmur, also keep track of that. Talk to your doctor regularly. And then unusual fatigue or shortness of breath with usual routine again. So you just want to make sure that you're paying attention to what you normally do and how you're reacting to it, and make sure that you talk to your doctor. If you have any questions about heart health, please leave a comment below. Don't forget to like, share, and just let me know if you need anything else. Thanks, and have a good day.